Welcome and thank you for joining us today. I'm glad you're here for this expert education presentation from the Sashbear Foundation. My name is Carol Moffat and I have the privilege of being a volunteer and a family member who has benefited by the programs and the resources offered by Sashbear. Our family loves all things Sashbear, and we've now got our next generation kind of bringing them up under the family, in the family, Sashbear family. I'm excited to be here with you tonight to learn more about parenting. No matter how old our kids are, we can always be learning more. The Sashbear Foundation is a Canadian charity recognized nationally and internationally as a leading voice for families impacted by emotion dysregulation, suicidality, and related mental health challenges. Before we get started tonight, I want to thank all of you who continue to support the Sashbear Foundation, raising awareness and reducing stigma to help ensure everyone has the skills and support needed for a life worth living. There are many ways to engage and volunteer with Sashbear, and you can always go to the website to make a donation. With all that said, thank you once again for joining us tonight, and I'd like to introduce our expert speakers. Dr. Jennifer Siddall is a licensed psychotherapist with over 14 years of experience providing therapy to individuals from diverse socioeconomic and cultural backgrounds in clinical settings, community organizations, and private practice. She is a member of the Canadian Counseling and Psychotherapy Association and holds a master's in educational counseling from the University of Ottawa. Jennifer has specialized training in Dialectical Behavioural Therapy, DBT, and trauma-informed psychotherapy. As Quebec's second DBT Linehan Board of Certification certified clinicians, she has extensive training in DBT for eating disorders. Dr. Melissa Stern is a licensed psychologist with over 10 years of experience working with children, adolescents, young adults, and families. She is the co-director of the Gray Zone Psychology and Wellness in Montreal. Melissa earned her PhD from McGill University, where her research focused on emotional regulation and self-harm in youth. She is Quebec's first DBT Linehan Board of Certification certified clinicians, and one of the few professionals in Canada trained in dialectical behavioral therapy for children. This is great. We've got two experts that are going to share with us some strategies of how we can integrate DBT, the dialectical behavioral therapy principles and skills for our families. And they're going to explore the concept of supersensers, children with heightened emotional and sensory sensitivity, and how this affects the family dynamics. So without further ado, I'd love to pass on the presentation to Jennifer and Melissa. Welcome, ladies, and thanks for being here.
Hi, everyone.
I just want to say thank you for having us. I'm floored by the amount of people that are here. I think it's so amazing how the devotion that parents have, or that people, the caregivers have. Thank you, Melissa. It's sharing. Perfect.
It's not me. It's
okay.
Lauren.
Thank you to whoever shared that. The devotion that you have towards doing the best for your kids, whether they're children, whether they're your adult children or your teenage children or your toddler children or your babies. Parenting is one of the hardest things I think we can all do. So who can't use more tools, right? You can go to the next slide. So we are going to be talking today about some very basic DBT concepts. We're going to be really discussing mindfulness and validation, which are probably, I would say, very core, fundamental to DBT for anyone who knows DBT. And also, I think, probably the most important tools when it comes to parenting. And they sound so simple. They are kind of simple, but they are not easy. Not easy at all. So we come from, Melissa and I co-own Gray Zone Psychology, where we specialize in DBT. We use DBT for everything. So we use it for, for borderline personality disorder, and we use it for severe emotion dysregulation, and we use it for anxiety and depression and pretty much everything, because everyone can benefit from DBT. Okay, go to the next slide, please. So yeah, you know what, you can pass the slide too. We'll do the Q&A at the end. So what is DBT? DBT is the focus on dialectical thinking. Dialectical meaning that there can be more than one truth. So we often get stuck in this idea that one thing is true. I have the truth, so I am right, you are wrong. And DBT is very, again, focused on the idea that we are looking at multiple truths, the concept that more than one thing can be true at the same time. I can be right, and so can you. So we're also balancing acceptance and change. When we talk in DBT, there's a lot of focus on acceptance. We can't change our situation, and we are still going to work on accepting it, even though we don't like it, right? So there's the dialectic, right? So I don't like what I'm having to face, and I still have to deal with it. But just because I'm working on acceptance doesn't mean that I'm going to get stuck in acceptance and only work on acceptance. I'm also going to focus on changing it too. So again, two very opposing ideas we're holding together at the same time. I often find in my sessions, I'm always going like this. I don't know about you, Melissa. So it's always like a little bit of this and a little bit of that. We're always kind of, and if you think about how a scale works, you're never really like, or at least for that long, you're never 100% like this all the time, right? You're always kind of teetering this way, and then you're teetering that way a little bit. And we're really moving between this kind of flow with acceptance and change. And of course, DBT is based on Marshall Linehan's biosocial theory of emotion dysregulation, which I will explain after. Next slide, please. In DBT, for anyone who's actually done DBT with their kids or their teenagers, walking the middle path is a very important concept. It's funny that we don't really use this concept in adult DBT, I find, but we probably could. So dialectical thinking is really, like I said, it's the idea that multiple things can be true and everyone's perspective is valid. So I could say, like in the example here, I'm doing the best I can, and I need to do better. I need to try harder. My daughter can be having a meltdown because she got into an argument with her friend, and I could say, you know what? It's not the biggest deal. Things are going to get harder in life, and you guys are going to make up. And this is also the hardest thing you've ever had to deal with right now, and that's okay. So my perspective is valid, her perspective is valid, and that's what we're balancing. So we're really walking that middle path of there are multiple things that are true, and we're really trying to, not the exact middle, but we're trying to find somewhere down the line where we can incorporate both sides. Next slide. So this is the biosocial theory that DBT is really based on. And I find, I don't know about you, Melissa, when we go over this in the group, or we go over this in our sessions, this is the thing that people are like, yes, this makes sense. This alone is very validating as an example to show. So the biosocial theory is really the idea that it's to show and to demonstrate where emotional dysregulation comes from. So first you have the biology, you can see in the first circle. So that will be our biological predisposition to experiencing emotion. So someone who might have a heightened sensitivity. And this is, a lot of us are just, as Melissa's going to talk about, supersensors, right? We're just a little bit more sensitive. Some of us are a lot more sensitive. And so the same stimulus that might be kind of nothing to your friend might be very, very emotional for you. Not only that, you're going to have that it's going to be very intense, and it's going to last longer than the other person. So whereas your friend might kind of experience a little bit of emotional intensity and then get over it, you might hold on to that for hours, days, weeks, that kind of thing. Hopefully not weeks, but like hours, days. So exactly, you never know. So that's the biological part. It's the emotional vulnerability that the person has. And then you have on the other side, the social environment. This is like when we're talking about the social piece, we're talking about an invalidating environment. When we say that, yes, of course, sometimes it can be And outwardly, it can be like an abuse situation, neglect, things like that. Often, though, what we're talking about is very well-intentioned, well-meaning caregivers caregivers, teachers, friends, peers, anybody who invalidate the person by, giving something like an inconsistent, inappropriate response or trivializing the experience. So like in my example, like I said before, let's say my daughter's crying because she's having she's had the hugest fight with her friends, and I say, oh, it's not a big deal. You're going to get into more fights when as you get older. You'll get over it. No big deal. I'm well-intentioned and well-meaning by saying it's not a big deal. But if I have one of those supersensor children, or I mean, even not, sometimes they might experience that as invalidating, like, oh my God, my mom doesn't get me. My mom thinks I'm silly. My mom thinks that they're probably not going to say this, but the message is my emotions are weird or silly, or they don't make sense, or people don't get me, or something's wrong with me. So they get invalidated by the environment. So what we're looking at is the combination where we see in the middle that dysregulation part, where this person has these intense emotions and they're within this invalidating environment where they're learning that their emotions are weird or too much or don't make sense. A lot of times we get like everyone tells me I'm too much kind of thing. That's the biosocial theory in a nutshell. Next slide, please.
Okay, so we're going to move forward and talk a little bit about who supersensors are, what do they look like, and you're going to probably recognize maybe yourself, one or a few of your own children or people who fit the supersensor profile. And just a few years ago in the DBT community, DBTC came out for children. We started adapting DBT skills, walking the middle path, the parenting principles for kids. And the term that we use to describe the children who benefit from DBTC are supersensors. So you think of DBT, you might think of borderline personality. We're really thinking about emotional dysregulation. And these kids are supersensors. So like you said, Jen, they're not just kids because we grow up, kids grow up, right? Our supersensors, individuals who are supersensors, are not just emotionally dysregulated. They're sensitive in different ways. So we're going to talk a little bit about that. So really, you're going to see there's a few slides because the characteristics don't all fit onto one. There's many different descriptors, but we'll start with, children who experience the world with an intensity that goes beyond the norm. So these children have heightened sensitivity to emotional sensory stimuli, which can profoundly affect their behaviors and interactions. So this can really get in the way of making friends at school, the dynamic at home. So let's just for a second consider we have a young boy named Alex, and during his typical day at school, Alex might find the noise in the cafeteria really overwhelming, causing him to cover his ears and seek a quieter space. In the classroom, he may become deeply upset by some classmates' harsh words, feeling emotions more intensely than others, and even the texture of the uniform can be sensitive and triggering for him during the day. Next slide, please. We also have this concept of emotional sensitivity and reactivity, like Jennifer was talking about. So emotionally, these supersensitive children are more overwhelmed by their emotions. They may avoid situations that require persistence or more effort. Their hyper-reactive nature may actually result in anxiety attacks and strong emotional outbursts. Talking about like meltdowns, when the emotional response does not necessarily fit the size of the problem. These children may also exhibit impulsive behaviors, act on emotional impulses, intensity, before really processing the consequences. these kids, they might be oppositional, but you really know it's because when it's more of a supersensor, when they feel upset about what the behavior was after the fact. I can't believe I did that. There's like this shame component that comes up. So when I think of a supersensor with these characteristics, I think of a girl named Mia who's emotionally sensitive. And during a group activity at school, she might feel overwhelmed by a minor disagreement with a friend. So just like Jen's daughter, and it might lead her to withdraw from the situation entirely from a minor, what we would consider a minor disagreement. Her heightened emotional responses can sometimes result in panic attacks, strong outbursts, crying, yelling when faced with unexpected changes. She may act impulsively, storm out of the room before she really has a chance to process everything. So this is just a little snapshot of what this overwhelm in emotions might look like. Next slide. Okay, so our supersensors also are, they get overwhelmed with sensory information. They have attentional challenges. So they might find certain textures, sounds, lights, not just distracting, but overwhelming to the point where it might even burn them out towards the end of the day because it's a lot of information for them to process. The heightened sensory awareness leads to difficulties with concentration, attention. It could lead to impulsive behaviors. These kids might be labeled as hyperactive or overexcitable and have a surplus of physical energy. So think about, again, our kids at school, the buzzing in the classroom from the lighting that is the intense fluorescent lighting, kids talking in the background, having to filter out information of what is important to focus on, what is less. This is going to be really difficult for our supersensors. If you're thinking, oh, this kind of sounds like ADHD, I just saw something in the chat. Yes, they can be mistaken for ADHD. Also, many of our supersensors are diagnosed with ADHD, so autism as well. So the supersensor criteria could be an indication of a diagnostic disorder, and or it could be the biological response to information. Okay, that next slide. Okay, so our supersensors really do well in DBT because they need help with the rigid thinking. So that black and white thinking that Jen was talking about, it's this or that. These are our supersensors. They can have trouble adapting to new situations. They thrive on structure, predictability. If there's change that's upcoming, they might resist it. Like, no, please don't change that. I like it the way it is. They may suffer from in their interpersonal relationships because of the flexibility that's needed in peer interactions, family interactions. Why won't you go take your bath at 7 instead of 7:30? That just the simple time of changing one thing by 30 minutes can really set the supersensor off, and they don't necessarily have the capabilities of coping with the changes. So our supersensors thrive on predictability. Okay, so this is a little, these are the characteristics. Now that I've explained what supersensors are, we're going to go to the next slide. And I really think it's important to highlight that supersensors have unique sensitivities, absolutely. And with the list that I showed, it's it looks like there's a list with a lot of weaknesses or challenges. But once we embrace the super sensitive sensitivities, we actually have the opportunity to create an environment that not only respects these children's distinct perspective, but also empowers them to thrive. So it's very validating for them once we say, hey, you know what? I think you're a super sensor. And there's the word super in super sensors. And super sensors need super parents, because the typical parenting that we're supposed to follow or our parents used or whatnot may not, or the style we use with one kid may not work with the next kid that we have in that family. So again, I think it's really important to think that these children have a rich, nuanced view of the world. With the right support, we can harness these strengths and really get them to excel in their lives. So we're going to talk tonight about what type of strategies parents can use to become super parents for their super sensors, really build up the environment of confidence and resilience. Next slide, please.
Okay. So one of the most important tools I think that is important for what we can teach our children, but also what we can practice ourselves is mindfulness. Now, often I find when we bring up mindfulness, people think, "Oh my God, you're going to ask me to meditate." I can't. We're often like we're busy, we're anxious, we've got a million things on our plates. We don't want to sit there and meditate, and that's fine. Mindfulness, there is mindfulness meditation, so there is definitely an overlap. But in DBT, for us, this skill, what we're talking about is not meditation. Mindfulness is really about non-judgmental awareness and presence. Think opposite of being on autopilot, really being in the moment and present. So what we want to do with this is really, like I said, stay in the awareness of the present. And when we stick with observing and describing and participating, which are the mindfulness skills, we are very much staying grounded in the moment without judgment. So I can give you an example. I find mindfulness very, very helpful and also very difficult at the same time. It's very dialectical for me. And there was one day where I was sitting with my kids and they were playing, and I think I was working on my laptop and everything was all over the place. And then I thought to myself, I'm just going to watch them for like a minute. And I wasn't really trying to be mindful. It was just, you know what, I'm just going to take a break. And I watched them. And I found that just the practice of watching them for like 30 seconds to a minute, I was seeing all these funny things they were doing that I never would have noticed had I not taken that few seconds just to watch. And in that moment, I realized all of a sudden, after all these years of teaching mindfulness and talking about it, that really was the moment where it clicked for me. Because I thought, wow, this was really, really helpful, because it took 2 seconds. And I feel like I'm here with my kids, even though they have no idea what's going on in my head. They're just like, Mom's sitting there. But I felt much more grounded and relaxed and much more connected. So I think everyone needs to go through a practice of mindfulness in order to find what really clicks for them and what works for them, because what works for one is not going to work for the other. And it really is it's a practice. It's a mindfulness practice. And you can start with something super simple, 30 seconds, and you can go to something much more complex. It really depends on what helps you. And so what I wanted to do was do like a very quick 1-minute mindfulness practice for everyone to kind of get a better understanding of what I'm talking about. So I chose something. I didn't want to make everyone close their eyes or get any special tools, but this is just something where you can practice with me. And obviously we don't have time, or we don't have the ability right now to process it after. But if there is something important that comes up, feel free obviously to put it in the chat and we can talk about it after if we have time. So what I want you to do is just pick an object around you, either something that you can pick up and hold, or you can just keep your eye on it, whatever it is, a pen, a phone, even your own hand. If you've got nothing, it doesn't matter. Just hold it, look at it. I want you to take a moment and observe the object, kind of like you've never seen it before. So just be curious about it. Notice its shape, notice its color, its texture, its size. Just really be an observer of it. Are there patterns? Are there imperfections? I want you to explore the details of it, how it feels. If it's something that you're holding, notice if it has weight. Is there a texture? Is there a temperature? If you're just observing it, imagine how it might feel. Imagine how it might feel if you tapped it lately. Now, I want you to think about this object and how it came to be. Who made it? What is it made out of? How did it become part of your life? Let yourself just be curious about it for a minute. And when you're ready, set the object down and take a second to notice how you feel. This practice really is about pausing and engaging fully with the moment. This is something you can do anytime, anywhere. Sometimes a common mindfulness activity, if anyone's done it, is to do the 5, 4, 3, 2, 1, where you're noticing your senses. These are great tools. No one will know what you're doing. You don't need any props. You can do it while you're in a waiting room. You can do it while you're lying in bed. And I hope, I don't know how everyone felt about that one, but I'm curious, even if you felt anxious while you were doing it, that's okay too. We're going to notice that we felt anxious, and that is being mindful. I noticed that I was uncomfortable. I noticed that I was wondering when she was going to stop talking. I noticed that I had nothing to pick up and I was wondering what was going to happen. All of these things are part of mindfulness. We can be mindful when we're brushing our teeth. We could be mindful when we're making breakfast. It doesn't have to be complicated, and it grounds us. Next slide, please. One of the very common mindfulness practices that we teach in our groups and in our individual sessions is this concept of the 3 states of mind. I have to say, this is one of my favorites. We use this all the time. So the 3 states of mind is the idea that we have different parts of our minds. We have the rational mind. The rational mind is the one that is logical, analytic, planned. I feel like most people have that rational minded person in their life, you know, the one who's got everything, all the spreadsheets, and whenever it comes to a decision, it's the rational decision. And this is great. This is when, for in your mind, we say rational thought, logic is in the driver's seat. Then you have the emotional mind. This is the impulsive one. This is the intense one, the overwhelmed. This is when, if you can think about you're driving in the car and someone cuts you off, right? Emotion mind right away. Oh my God, how dare they? I have my kid in the back, and all that flood of emotion that comes to you. That's when you're in your emotion mind. Emotion mind is when you do not want to make decisions, because when we often make decisions from our emotion mind, we can do things a little bit more impulsively. And like I always say, I try my hardest not to write emails or responses in emotion mind. You know, sometimes we get angry emails from parents or something, and then I'll want to respond, and then I'll be like, no, you know what? Hang on, wait. Things like that. We want to be in our wise mind, which is that center one, which is the balanced, effective, skillful, aware state of mind, where we are still balancing the rational part and the emotional part. So we're taking into account how we feel. We're taking into account what's logical and what makes sense. And we're finding that middle ground where everything is still valid and part of the decision and part of the action, but it's a more balanced approach. And so this is a mindfulness exercise, because in order to determine what state of mind you're in, you have to pause, you have to take a second, you have to say, hold on, where is my head at right now? And that's being mindful. Often this tool is enough to bring someone back from a 10 on 10 to like a 5 on 10, so that they can sort of take a second and say, hold on, I'm not going to react, I'm not going to respond, I'm going to wait, and then I'm going to decide what I'm going to do that's effective. Next slide, please.
So once we're feeling more mindful about what state of mind we're in, I think we can acknowledge the fact that being a parent is not so easy. And parents face many unique emotional challenges. So I've listed some examples of when parents might struggle in the morning with our evening routines, getting the kids ready to go to school, homework time, meal time, discipline, challenges. So after a long day of work, we don't want to be arguing with our kids to get them to do something. We don't want to be arguing with them to sit at the table, participate in the conversation, help clean the dishes. These are not things we want to be doing. These are things that put us in our emotional mind, as Jen said. If we're parents who work, Jen, I don't know about you, but that few minutes when you went to watch your kids, sometimes there's that work guilt feeling of not being always present in the moment, to be there for special moments, routine family time. And let's face it, as parents, we are human beings with our own vulnerabilities, and often we sacrifice our self-care, which can lead to burnout, frustration, and again, lots of emotional mindness in parenting mode. So because parenting can put us in emotional mind, it's very important that we have strategies as parents to be able to regulate our own emotions, our own frustration, our own expectations of our children in order to be super parents. I'm going to talk a little bit about why it's so important for us to keep our emotions in check on this next slide. So I'm going to use the model of emotional regulation that's really key here in DBT, and especially with our kiddos. So it's the concept of co-regulation, and I don't often hear enough about this concept. I don't know if you would agree, Jen. I feel like this is a concept that is not spoken about enough in the literature, in webinars like this. It's not something that many people are familiar with. So this is why I want to bring it up tonight and spend some time on it. Co-regulation, C-O with the dash, there's more than one person regulating here. And so this process is key, where parents can help their children understand and manage their emotions. Let's be real, children are not born with the ability to regulate their emotions. Just as they learn to walk, learn to talk, emotion regulation is a skill that develops over time with guidance and practice. In the early stages of life, children rely so heavily on their parents and caregivers to help them navigate emotional experiences. So it's really through this co-regulation that parents can provide support, comfort, guidance, teaching for their children by modeling, guess what? our own calmness and setting boundaries. Okay. Again, why, as parents, really important for us to be regulating ourselves because we need to be modeling it to our children. They are watching us to see how we react. This process is not one size fits all. It requires mindfulness, which is why we brought it up earlier. It requires sensitivity to knowing when your child is in emotional mind, when you're in emotional mind. And because if you do have a supersensor, you may have to tailor how your co-regulation, your response fits your child. So when parents co-regulate effectively, they're not only addressing their child's immediate emotional needs, but they're helping them develop skills for the future. So I don't have my cursor on the image, but if you look at the first image on the left, you'll see the waves are out of control. And there's a little boat trying to just keep up with the current. That is a child who is dysregulated and does not have coping strategies. This is children when they are learning how to regulate. The middle picture are the two boats, and the water, while it's wavy, they are much calmer waves than in the first image. And so the parent boat is accompanying the child boat through a situation, helping the child learn how to navigate that situation, navigate the seas, so to speak. And then in the last photo image here, you have self-regulation. This is when our kids will know on their own how to regulate their emotions. So the waters are even calmer and they're in control of doing this on their own. Next slide.
I also just want to add to that. I find it interesting because we talk about, and it's 100% true how we co-regulate with our kids, but we also co-regulate as adults too. And if we think about parenting, we co-regulate with either our co-parents or just any other adult in our environment sometimes, right? Like even Melissa and I co-regulate sometimes if something happens that activates one of us, and like if I'm activated, I'll go to Melissa and her calmness will calm me down and vice versa. And I think that's also a really important tool to know. Sometimes like if you have a partner and like let's say you get activated in your house and then you'll say, okay, you take over. And that's skillful, right? Because then your co-parents can say, okay, you know what, I'm more regulated, so I'm gonna navigate this one. And yeah, don't underestimate the power of co-regulation even for adults as well.
I agree.
Even when we know what to do, we forget.
Thank you, Jen.
Okay. Validation. Okay. Another really important tool. Validation is recognizing that a person's feelings, thoughts, actions, behaviors, all that are valid. This is not agreeing with the person. This is not saying, yeah, you're right. It's, I hear what you're saying. I see you. I get you. That's not the same thing as, yeah, you're right. Sometimes it can be, but it doesn't have to be. And what it's doing is showing the person we care, we are listening, we hear you, we understand, and very importantly, we are not judging. I might not agree with you, and I'm still going to listen to you and hear you and send the message to you that how you feel or what you're saying still makes sense. Next slide, please. So validation is demonstrating it's not about good or bad, right or wrong. It's just that you make sense. And if you think about, I love giving the examples of like customer service and things like that. If you, Melissa knows what I'm thinking about. When you are feeling activated or dysregulated, and you're calling customer service and you're asking for help, and they're basically telling you, well, or giving you the message, well, there's nothing I can, you're crazy, and did you unplug it and replug it in, and like that kind of thing. You get more frustrated because the message is like, well, you're not hearing me, you're not listening to me, I'm alone, you're not helping me. Versus if that person says to you, even if they don't agree, even if they think you make no sense, and they say to you, I get it. I get that you're frustrated. I get that this is really hard for you. I get that this is making no sense to you. It has that magic ability of just calming our emotions and just giving us the message, okay, this person is at least hearing me. They don't have to agree with me, but they hear me. That is so soothing. Next slide, please. What can be validated? This is often, I would say, I don't know, Melissa, if you feel this way too, I find it's a tough sell sometimes to explain to people to validate, because they, like I said before, they often think, well, but they're wrong. I'm not gonna validate something that's invalid. So what can be validated? Emotions. No one can ever tell you that you don't feel something, right? Your emotions are always valid. That's the rule. I don't have to agree with them. I don't have to get them. And they are still valid. Behaviors. They have some validity given where they're coming from. So a good example I find is sometimes we talk about self-harm, and we'll say, we don't want our clients or our friends or any loved ones to self-harm. And we can still say that we understand where it's coming from. So I'm not agreeing with self-harm, but I'm saying, I get it. I get why you're doing it. And that alone, for someone who's experiencing this type of thing, is saying, well, at least, because they've often been through a situation where someone will say, what are you doing? Are you crazy? You can't do that. And there's a big reaction, a big invalidating response. Whereas when we say, okay, I get it. I get that it serves a function. I see why you're doing it. I understand. And can we find other strategies that might be more helpful, more beneficial to you, more adaptive? And that also is just super, super helpful for someone who's struggling. Thoughts can be valid, given the history, given the learning, given we all come from somewhere. We have experiences, we have lives and things. How we think comes from somewhere real. Might not be the same as your neighbor, and it's still valid. And your body sensations. We all have different biological responses. Mine might not be the same as yours. Doesn't make mine more valid or less valid than yours. Next slide, please.
I'll remember that the next time someone says something about me yelling, because I thought something startled me in the office. It was just so natural as a reaction. I'm going to remember that it was valid. Because everyone was like, why is she doing that?
What else does validation do? It creates a foundation for change, because then we're creating openness where we can have a dialogue and we can have a discussion. It encourages accurate labeling of expression, of experiencing. In DBT, we often use accurate expression as the way to explain how we're feeling about something. It fosters effective communication, because I can validate someone and then they can say, well, I can say, Melissa, I really think I get that that noise has startled you. And then she might say, no, it was just because I couldn't believe that thing was there when I already said to get rid of it, or something. I don't know, whatever. Like, she could correct me if I'm wrong. It decreases shame. You make sense. You are not weird. You are not crazy. You are not too much. You are having an experience based on something that makes total sense. Nothing to be ashamed of. It promotes self-validation. When other people mirror validation for us, or model it, we can mirror it back, and we can learn how to do it for ourselves, because that's, in my mind, the ultimate power, when we can learn to validate ourselves and to say, how I feel is fine and makes sense. and it strengthens relationships. When we feel heard and we feel understood and we feel like we're not crazy, we feel closer to the people who care about us. Next slide, please.
So here we're going to talk about, is this me or you, Jen? It's me.
I thought it was you.
It's me. Good. Got it. So we're going to talk about how to validate other people's emotions. So we really want to break this down to make it as simple as possible, because it's so, there's a book called The Power of Validation. It is so powerful and we don't want to overcomplicate it. So when actively observing and listening to someone with an open manner, we are validating. So if this was an animated slide, you would see the little sloth's head moving slowly, nodding. So we're slowing down, we're getting to eye level, softening that voice, leaning forward, nodding the head. Yeah, that sucks. That's validation right there. I don't know if just me modeling it gives the impact, but we really are not intimidating. We're trying to provide a safe space where we're just saying, yeah, I'm listening to you. I'm watching you. This is your space. I'm here for you. Next slide. We can also validate by reflecting back what was heard or observed. So this is, validation is really like acting like a therapist. If we're gonna be honest here, and I think that's why our clients like so much to be validated, and when they get it out in their environment, it really works well. So here we're trying to help clarify accurate emotions, thoughts, behaviors, or body sensations. So after he didn't pick you for the game, you thought he doesn't like you. Is that right? So I'm listening to you. I'm going to like summarize what you said, but I'm also going to leave room for error because this is how you're feeling. I want to make sure I get it. You know, I'm listening. You know, I'm here. And I might actually not understand. So if that's the case, let me know so I can understand. Next slide. We can communicate with our words. Here that makes sense. That sounds really tough. It makes sense that you felt really scared when you heard that noise. Thank you. I know, right? It was really scary. It's really powerful. I understand that. That sucks. Your kid comes to you. I had such a bad day. That sucks. Do you want to talk about it? Opening the door right there. What a bad, icky feeling that must be. Again, in each of these different quotes, sentences that you can use, we're not agreeing, I'm going to talk about what validation isn't, but we're not really putting a judgment quality on valid or not valid. We're just saying, like, for you, it is. Next slide. So here's the actions piece. Sometimes we're not great with words. And that's when we can use our actions, our nonverbals, to convey, relate validation to others. Hugs can be validating if this is something, I'm going to say children, but anyone, if they're open to hugs, then it's not an aversive type of sensory sensation. Hugs are a way to go. They communicate love, safety, and presence. Sometimes the squeezing of the hand, like putting your hand on someone else's, like that's rough. Again, if touch is okay. sometimes we sit closer to that person. So we might be facing them and then we go sit on the couch next to them just to have that close proximity. Just that sends the message of I'm here. Mm-hmm. Mm. Mm-hmm. I don't know if you can pick that up with the microphone, but just those small, not words, but just sounds of I'm listening to you. Jen's validating with actions right now by nodding her head. Being focused, I'm going to jump one. Being focused in that moment is validating. So if someone is coming to you and they're emotional and yeah, so wow, yeah, that sucked. That you must have had a really rough day. Yeah. That is not necessarily conveying validation that I care. It's, yeah, I'm going to talk to you, half pay attention. So just being focused, engaged, like with that eye contact, nodding, that shows that we're validating, we're here. And the last one is our parental urge is to solve problems. Who wants to see their child suffering? Who wants to see someone they care about suffering? Nobody. And so when we see people suffering, our automatic impulse is to solve the problem for them. We really have to be careful with this because people who need to be validated are not looking for problem solving in that moment. And that might be a tough pill to swallow because it's our instinct to want to help people solve problems. But we have to be careful that there's definitely going to be problem solving, but it may come when the person is validated and regulated. But in that moment, we just try to understand, not change things. So think the stress tolerance skills if you are familiar with DBT skills. Next slide. Okay, so really quickly, it's important to distinguish what validation is not. So we're not just agreeing, praising, complimenting. It's not about giving approval. I don't, like Jen said, I really don't have to agree with what's going on in order to validate. It's just about acknowledging someone's inner experience as understandable and legitimate. It's not about being dishonest or just being nice to make people feel better. It's really about accommodating what people need and require. So a really great example, Jen said, she highlighted the fact that we often co-regulate. Validation is so key, even if we're very alike and very different people. And so sometimes I'll ask Jen, I'm like, does that happen to you? And she's like, no. And I'll be like, oh, okay. And then she's like, but that must suck. And I'm like, yeah. So just that, she doesn't even know, she may not have ever experienced it. It's not the case for her, but she's making that space for whatever my experience is to be valid, to have to just be whatever it is. And again, when we're parenting, the urge to problem solve comes back, and we're really not trying to lecture or give a lesson. We're just listening and understanding. We're not playing therapist. True validation is focusing on the person's feelings and not on our own responses to them. Okay, next slide, I think is a video, and we're not going to watch it, but we will share the link of the video. It's called It's Not About the Nail, and I don't know if people have seen it. It's hilarious. I crack up every time I see it because this lady has a nail sticking out of her head, and she's just looking to be validated, where her partner is problem solving, and they're just not clicking. They're not connecting on what is really needed for the said person with the nail sticking out of their head. And anyway, we'll share the link, and you can watch it for a really great example of, and funny, about what validation looks like. On this slide, it's really just a amalgamation of some things that are validating and some things that are not. So I invite you to look at the different bubbles and choose if that whatever's written in the bubble is you consider validating or invalidating. So that might be discouraging. That would, for me, be a validating statement. You just need to try a little harder is invalidating. I would consider that invalidating because you're telling me what I should be doing instead of saying, oh, it was hard for you. I don't need to know what to do different next time. Just acknowledge it was hard. Okay. I think that brings us to the end of our slides. Or not, no? Oh, no, it brings us back to Jen. Okay.
It brings us back. I'm just mindful of time. So I'm just gonna like go through this really quickly. And then if anyone has any more questions about this, I'm kind of repeating a little bit about what we have already talked about. But basically, well, the idea is, when do we validate? Because I think a lot of times we make the mistake, and I myself included have done this many times. We validate at the height of the crisis. So think like your child is having a tantrum or a meltdown in the mall. And I'm thinking to myself, okay, this is I have to regulate her. I'm going to validate her, and I'm going to say, oh, this is very overwhelming for you. I get it. And they're like, stop talking to me, right? And it's not working. And then so many times we'll get parents saying to us, like, it didn't work. Of course it didn't work. First, I get it. What we want to do is we want to validate at the beginning of that bell curve when we're seeing the emotions rise. We're seeing like what's happening. We're seeing, like, I would say, if we're looking at like on a scale of 1 to 10, 10 being the highest emotion, maybe like 1, 2, or 3, up to a 5 we're validating. Then again, at the end, wow, that must have been really difficult for you. You were really, like, that was a really hard moment for you. Okay. And then we can also, and we're not talking about this tonight, but that's where we can talk about problem solving a little bit. Okay, maybe what do we need next time? What would have helped you in that situation? Would a hug have helped you? Maybe we should have left. Would that have helped you better? Things like that. But we're basically, all to say is we're not validating in the height of the moment. It's most likely not going to work. Think beginning and end. Is there another slide after? I can't remember. I think there's one more. Yeah. And then, like I said, when to solve the problem? At the end, not in the middle of the crisis. And that comes back to a little bit like what we were saying before. When you're in emotion mind, you are not thinking problem solving. When that guy cuts you off on the road, you're not thinking, okay, I need to use my skills and I need to regulate and I need to turn on the music so that I can calm down. You're thinking, you might not even be thinking at all. So it's really, really hard when we're activated to problem solve. We want to bring down the emotion, and then we can talk problem solving after. And at the beginning.
So this is important because we can prepare before a situation. If we know what our children's vulnerabilities are, to say, I know that will be difficult for you. You know, we're going to the mall later today. How can we make that experience easier for you or more enjoyable? So we're solving the problem beforehand with a touch of validation because we're saying, I know it's hard. There you go.
That's it.
I've been seeing a lot of questions come up, so
yeah, we're going to go through them all. Thank you so much. That was awesome. I loved it. And, you know, I've been around the DBT space for a couple of years now, but hearing that walking the middle path was a great way to talk about that balance that we're all trying to do. So first question would be is, how do we walk that middle path when we're triggered too? Right? So you talked a little bit about co-regulation with our loved one, honestly, like I'll put my hand up, I get triggered, and I'm emotionally dysregulated too. So how do I get co-regulated while you're in the midst of it and you're trying to deal with someone else, and you are dysregulated, but yeah, what do we do?
Skills. It's easier said than done, I think. But practicing distress tolerance skills has been, at least for me, someone who is a super sensor, key, and knowing which ones help.
I think that's kind of what I was going to say too. It's not going to be one skill that's going to do it all the time. You want to plan in advance what things would work for you. So I can say, like, very similar to you, Carol, like I will get activated. I have 3 kids who all activate me in different ways. And I know this stuff, I teach this stuff, and I still struggle with it, right? Because when you get into your emotion mind, it's really hard. So sometimes it'll just be walking away if the situation is safe. Can't walk away in the mall, but I'm at home, I will walk away, and I'll say, I need 5 minutes. Just give me 5 minutes, I'm gonna come back. Close my door. It can be music, it can be whatever it is, and there's so many skills. Really, when you're calm, practicing different skills and seeing what you like and what fits for you and what works in your environment. In our groups, we do skills boxes where we have like I have mine here, a box of things that work for us. You can't always have your box everywhere, but we sometimes make one for the car, we make one for home, make one for, like, the kids love making them too. And then that's what you turn to. And it's not easy. It's not easy at all. It's just practice.
A lot of practice and mindfulness, because you have to be mindful to know what's going to work. So I know if things are too loud, I need to go into a quiet space. That's literally my number one. Less stimulation for super sensors, whatever that stimulation might look like. And the only way I started knowing that was by realizing, wow, I am so much calmer in quiet spaces. Anxiety rises as sounds rise. And I couldn't do that without mindfulness, being aware in the present moment.
So a lot of people are asking about your little box and those skills. I saw you going into your desk. So
I saw someone else. So this isn't everything, but it's a good example. So this is like the softest, you can't tell, obviously, it's the softest thing I've ever felt in my life. So it's nice and cuddly. I have a cream. Yes, it's for stretch marks, but it's because it smells like cocoa butter and it's so yummy. And I like putting it on my hands.
No judgments allowed.
I have chocolate, which I'm actually really excited to find because I was looking for chocolate earlier. So here's some chocolate. I find it soothes me. I love it. I have fidgets. So I have this one. I have this one. I was also playing with this one before. I have a stone. I don't know. Sometimes it's more of a spiritual thing. I wouldn't say that this is something that calms me, but it could. I have tea. And I have this stone. I like it just because it's really soft and smooth. And I like the color. So this is more of a mindfulness thing. If I'm not too activated, I'll look at this and I find actually it's a distraction now that I think about it, because it's got pretty colors. And if I just focus on it, it just keeps me distracted.
It's still in the present moment, so you're still being mindful.
Yeah.
right?
That's my box, my trusty box.
Okay. So we know that, a lot of things can be going on at more than one moment, right? And things coexist. So whether it's ADHD, etc., that can be coexisting. So when our supersensors, that emotional dysregulation kicks in, and that hyperreactivity results in those anxiety, panic attacks, how do we discern that it's not poor behavior, that it is an anxiety attack, that it's not the ADHD kicking out? Like, how do we know how do we discern that as a parent that's got that super sensor with a lot going on?
Okay. So self-declared supersensor, I have supersensor kids, and I feel in my practice, I've heard the word manipulation a lot. They're acting out to manipulate me and get me to react or pay attention. And I want to just ground us in the idea that children are children. They don't wake up in the morning and say, I am going to, I want to piss my parents. Oh, sorry. I want to upset my parents in 10 different ways today. Let's see how I can do it. Look around the environment. What are the triggers? What are their vulnerabilities? What are they struggling with? But I think it's important to put our parent brain, or even with our partners, our friends, put our brain on default to they are doing the best that they can. And so it's very likely they are dysregulated. Default. And, until we have evidence otherwise, let's go to default of that's dysregulation.
Okay, great. Thank you. All right. So I'm going to kind of bundle a few questions together in themes. And it's really around that teenager, the young adult. So looking for some coping strategies for those supersensors in that category. And I'll break it down and you guys can jump all over it. But the personal hygiene, why is that a problem with them to begin with? And how do we help them? And more, how do we just encourage our young adults and our teens to engage in the DBT skills, whether it's through DBT therapy, counseling, whatever that might look like. But how do we get them engaged so they can benefit from all of this, whether it's getting them to do mindfulness, learning wise mind, because let's face it, our teens and our young adults, I mean, just ask them, they'll tell you that they're smarter than us. So they know us.
We probably are.
But, in a lot of ways they are, right? Some of them are absolutely brilliant, but it's that whole engagement around a lot of different areas. So throwing it at you, ladies.
So hygiene is one of the things I see so much in practice as being an issue. And when I saw it pop up nonstop in the chat, I was not surprised. I think my conceptualization around it is a bit complex in the sense of, let's think about it sensory wise. We're asking kids to go maybe get like wet in cold water or hot water, and they might not like that sensory feeling. So that might be aversive for them. It also may not be the most stimulating activity of life. They much rather be on their phone, watching TV, chatting with their friends, whatever it may be. And we're asking them to take time out of a stimulating activity to do something not as greatly stimulating. There's also the factor of when there are symptoms of depression, personal hygiene is like at the bottom of the totem pole. And Jen, I feel like you've seen that so many times as well. There's no motivation. There's a lack of wanting even to care for themselves at that point in time. So that's how I see it. I don't know, Jen, if you have anything to add to that.
Yeah, so I agree with all of that. And what I would say, and I know this isn't the magic tool, I find when we can take away the fight from it. So instead of you have to shower, you have to brush your teeth, you have to do all these things, I would encourage you to try it with some validation. I know you really don't want to put down your phone. I get it. I know you don't like to shower. I get it. And
I get it, Mom.
And we're balancing. I don't think you want to smell. I don't think you want to look dirty. So
even though you're not, I know you don't like it, maybe is there a way to do it even though you don't like it? We're trying to build some agency and build some sense of choice here. It sounds a little manipulative, and I guess it isn't a little bit, but not in a bad way. But it's like, how do we manipulate the situations that they feel that it's really coming from them and they've got some choice over it, even though it's sort of like, you know, you want to wear the red shirt or the blue shirt, you got to choose one. You got to take a shower. It's a matter of, are you going to do it in a way that's less taxing on you? So put some validation in there so that your teen isn't like, oh my God, she doesn't get it. All she does is nag me. It's okay. At least she's hearing me. At least she hears that this sucks.
And I'm reading in the chat the PDA profile. And that's what we're seeing a lot of now in our practice as well, is a demand avoidance, persistent demand avoidance. And I feel like validation can go a long way when working with the PDA profile of just, it's too much because it's a demand.
That's why I sort of phrased it like, and I know you don't want to smell. So it's not, I'm telling you, you're going to smell and you have to take a shower. It's more like it's pathological demand avoidance. It's more like an invitation to shower so that you don't smell.
Okay, so that's great. The personal hygiene. Now I'm going to pull back in. How do we get them to learn the DBT skills, to participate in the DBT counseling therapy? Call it what you will, but just to kind of get them some skills, and we're not just role modeling for that. How do we get them engaged?
Okay, so I don't know about you, Jen, but I know a good therapeutic alliance is really key. If the teen or child is in therapy, if they have a good connection with their therapist, and they also find the utility, like for them, the life worth living goals, how it will benefit them if they have a buy-in to using the skills, if they have agent choice around it. Again, not that demand you need to go to therapy and do skills. I think these are factors that could help. Jen, what do you think as well?
Yes. And I think if a lot of times, like, you know, we talk about in specifically in eating disorder treatment, we're not talking about, it's not my goals. It's not, how do I get you to eat or stop doing these behaviors? It's, if your goal is that you want to go to school or that you want your parents to stop bugging you, how do we work backwards to get to your goal? So it's your goal. So in order to get your parents to stop bugging you, let's do skills. In order to get you to school, let's get you to do skills. That type of thing. So we're working from within their framework so they feel a sense of like, okay, we're working on what I want to work on, not what the therapist wants to work on necessarily, or not what the parents want to work on.
They can't even get them to that point. I think that's what I'm sensing, and this is what we hear a lot in family connections, right? How do we even start having that initial discussion? How do we get them out the door to that place, right? Like their choice. When you talk about their goal is never to meet you.
So we have this all the time. And in our consult team, we meet once a week, our DBT team, and we go over cases. We've actually found a time frame of when we see change start to happen, flexibility, willingness to use skills. So oftentimes, people doing DBT, it's a 1-year program. They will start until at least month like 3 or 4. They're like, it's not working. Nothing's changing. I'm not seeing results. Or parents are saying, you know, it's not working. My teen doesn't want to come. There's something about sticking to it and that common lived experience that DBT gives. And if there's like a turning point that we do see. And so I think it's really just practicing, and not just practicing like mindfulness or, you know, the tip skill where you put ice on your face one time and I'm all better now. It's, I'm going to try that skill and add more skills for months and build a cute kit like Jen has. And then I'm going to be more, that's my kit. I want to show it to everyone. I know what's in it works. It's time. A factor is time.
And is it okay to bribe our I'm going to use the word bribe. They didn't use the word bribe. That's I'm layering that into the quote. But that bribe to get them to come to you.
So that's actually what I wasn't gonna use the word bribe, but I'm gonna say link it to what matters to them. So if you are saying, okay, like sort of like I would have said before, you want me to stop bugging you about not going to school? Let's do this. And that's actually one of the skills. If for anyone who's familiar with the Dear Man, we're telling them one of the elements is kind of telling what the other person is gonna gain from it. So can we try this? Can we commit a few months to this? And that way I'm going to stop bugging you about blah, 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 as long as you're doing your part, and let's see where we get. It's kind of like a commitment strategy too. It's like, let's try a little bit, you give a little bit, and then, you know, we can push a little bit more or a little bit less and do that little dance. But I would connect it to what's important to them.
I also think with teens, which is why I love the C and especially the teen program. And I get upset when, you know, at 18, we lose that parent component in the way DBT was developed, but parents have to come to the groups as well. And so there's a validation, a shared feeling of like, yeah, there's things I'd rather do from 5 to 7 on Thursday evening, right? So I get it. It's not the most fun thing you want to be doing right now. We're doing it together. Like, you're not alone. We're also in this.
And to add to that, this isn't all on you. This is both of us. This is a dance that we're doing together. And so I'm going to want you to be more skillful. And I'm also going to learn different skills so that I can be more skillful, because who can't benefit from more skills? So I think also incorporating yourself in the process it's not all on the team.
Thank you.
Oh, and for kids, we work mostly with the parents. The kids don't come till 12 weeks in, and they only stay 6 weeks to learn skills. Otherwise, it's full middle path parenting skills.
How do we use our skills to manage schedules? Again, back to teens, you know, when balancing those things out of having a decent bedtime so that in the morning we can actually get up, right? Kind of balancing those things, or how are we transitioning them where when they were little, everything was so easy. And now all of a sudden there's a point in time that some people notice that things change. And, you know, one of the examples is, you know, winter was a great time, playing the snow, lots of fun things. And now it's, you know, they have panic attacks because it's going to snow. All of a sudden something changes. So how do we transition those, and how do we work those in using our skills?
I always say as parents, detach yourself from outcomes. The attachment to outcomes of it should be this way, or it's always going to be this way, it was like this before, is a trap that parents often fall into. That could be like I called it a trap because we're falling into it. It's not helping. I also think picking our battles with our kids. Like I saw a comment, it was like, okay, yeah, we're expecting you to take your shower by 9 o'clock, and that's the end of the conversation, right? Like there's a boundary there, and it's not like this back and forth of bargaining and so forth. There's clear boundaries, and I'm also not going to stand there and yell at you because I'm choosing my own sanity and wellness at this point in time, picking my battles. Jen, I don't know if you wanted to add anything there.
I'm thinking just about, we often give that list of like normative teenage behaviors.
Mhm.
So again, it's similar to detaching from outcome, and it's certain things are just very normal and annoying teenage behavior. And
Kid
we got to
behavior.
pick our battles, similar to what you said.
Yeah.
I'm going to go back to anxiety and panic attacks for a second here. And the question was really about, is this harmful for their health-wise, or can they be beneficial to help build resilience and increase acceptance over time? So, when you're dealing with those anxiety and panic attacks, do you kind of let them run their course? Like there's something beneficial, or how do you take what's beneficial out of them? Do they contribute to resilience over time, or, how does that fit in?
I was having this conversation with the psychiatrist at our clinic this morning. Because especially with anxiety, there's a tendency for avoidance to want to remove whatever is causing anxiety. But then we're never really learning how to cope with whatever is causing anxiety. And so this is where acceptance does turn into resilience. Because if you learn to cope with the feeling of anxiety, so discomfort, the distress tolerance right there, you are becoming more resilient instead of avoiding what makes you anxious. That's an accommodation. I don't know if does that answer the question? Yeah.
I think a little bit, yes.
Understood it.
But you brought up accommodation, which is another question. So can you go back to, you were talking about what is not validation, and you had accommodation on the what is not validation. Can you re-explain that? Because we use accommodation both validating and not validating, right? So yeah, if you can talk about when it's not validating.
Hey, sweetheart, I know you're so anxious about this, and so we're just not going to go there. We're not going to the mall because I know it's overwhelming for you. An accommodation of like avoiding. It's avoidance. Now, sometimes we do have to avoid those situations. And I'm going to use the word and instead of but. When we do make changes or decisions to not do something, it's beforehand. It's not in response to the emotion, to the meltdown of anxiety. I am not going to give you that ice cream cone because you're lying on the floor and yelling and it's embarrassing and I want to go home. So I'm not going to say, oh, honey, I know you want it. Here it is. I'm not going to be doing that. I'm going to say, I know you want that ice cream. And we'll get ice cream another time. Let's go. I'm going to pick you up now. So we're not giving in necessarily. I think that's the key.
Great. All right. I think I know the answers to this question, but I'm going to leave it to the experts. Is validation taught in DBT, or is it just used as a therapy tool by the therapists?
It's a great question. Both. So that's how powerful it is. We talk about it as therapists, how important it is, and we teach it to our clients.
Well, we do it with for our clients, right? Also, but there is skills taught on how to validate and how to self-validate. So once you've mastered validating yourself, others, you can then move on to bring it towards yourself, which is often a key piece that's missing when we're in an invalidating environment, is bringing it towards the self. I don't need you to tell me that it's okay to feel this way. I know it's okay to feel this way. And that's really powerful and strong.
The question here is DBT something that my child will have to do for years to be effective?
Sometimes they love it so much that they do. But we have contracts, time limited contracts. So really our goal is to get out of distress, that really rough period, within 1 year. And then it's support as needed. But it really depends on our clients. What do you think, Jen?
Yeah, I could say that there's a difference between what's required and then what's helpful. And I think it's a very case by case thing. So there are some people who learn the skills and then that's it. No problem. Some people come back because they want refreshers. I can even say I do this stuff all the time, and like when Melissa was talking about the co-regulation with the little boats and everything, I thought, oh yeah, this is a good reminder. So it really depends on your needs, and it depends on your kids. Some kids, they get it, or like you get it as a parent and you're able to do it, and you change the environment and everything is relatively fine. And sometimes it takes longer.
One of the questions we're getting here is a lot of questions about, and you knew as we were going, when people were logging on, we've got folks from literally around the world that are participating. So how do you find a DBT therapist or a DBT group in your area? What are the things you should be looking for? Because a lot of people are asking, different locations and stuff, and where you guys are located, and, and I think it's a pretty long commute from Australia to Montreal, but
Very doable.
yeah. So, but how do you go about looking for a good? Because you mentioned about having a good therapist, but how do you go about finding one? What are the tips and tricks about that? Because that's a challenge for all of us.
Jen, this is your pedestal to preach.
Oh, this is a big one for me. You want to find, because I think where I sort of, why I'm passionate about this is because a lot of people say they do DBT, and doing DBT for just sort of lightly incorporating it into the treatment and knowing about it and reading a book or taking a seminar, that's one thing. Doing DBT the way that it was designed to help people with emotion dysregulation requires a lot of training. And the gold standard is certificate, like Linehan board certification. So if you want to find a Linehan board certified program and or therapist, if you go onto the Linehan board website, you can search there. There's a lot more in the States than there are in Canada. I'm not familiar with how many there are in other countries, but they are all around the world, and it depends on the licensing. And if you can see, there's a lot of, since COVID, like luckily we have a lot of virtual programs, so you can inquire in terms of, again, it depends on the licensing, that you can access a lot of these programs online too, which is great. But I would really encourage, do your research and make sure that the therapist that you're seeing isn't someone who's just saying, yeah, I do DBT. What is your training? What have you gone through? What are your certifications? Are you part of a consult team? That's the biggest one, because the consult team is what keeps us doing DBT adherently. We keep each other on it, and we make sure that we're not veering away from the treatment itself. We actually on our website have a list of questions to ask.
Coaching,
Yeah, phone coaching, exactly. There's elements of real DBT, so you want to make sure that you're asking those questions.
Okay. And this will be our last question because we have to be mindful of time. I know we have the DBT-C is DBT for children. Someone is asking, what's the difference between DBT and RO DBT?
You can tell we're very passionate about DBT. We get excited about the questions. So Linehan, Marcia developed DBT, Dialectical Behavioural Therapy, really from what she liked and didn't like about her own experiences in therapy. So not through theory, but through lived experience. I think it's amazing. RODBT is radically open DBT. It's designed by Thomas Lynch, if I'm not mistaken. And what he has done is he's kind of turned DBT on its head, in the sense of DBT the way Marsha did it, is for people who are under controlled, who have emotion dysregulation, and it's very apparent. There's crying, there's self-harm, there's arguing, it's just so obvious that they're suffering. In RO DBT, we often work with over-controlled people who are over-controlled in their emotions. They're not showing us that they're anxious. Everything's fine. No one is aware of the suffering except that person. Often there is self-harm because they're internalizing everything. And so Thomas developed skills that work best with people with that type of presentation. And that's how they really differ from one another.
Great. This has been awesome. Thank you so much. This has been so helpful, and I hope you're seeing in the chat and in the Q&A the positive feedback that we're getting already, and how helpful it has been. I just love that we always learn something. So we really thank you for spending some time with us. And I'm going to pass it over to Lynn for a moment before we close tonight.
Thank you, Carol. I just want to say thank you to both of you, Melissa and Jennifer. That was wonderful. So really excited to have been having the pleasure to listen to your presentation. And like Carol said, like people, I think, really appreciated it. And then we had like great participation. So thank you, and looking forward to have you back maybe in 2025. Never know. Thank you very much.
Thank you.
Love sharing our knowledge and our passion for this treatment. So thank you.
And thank you to all our people that participated to this great webinar. So good night, everyone.
Thanks, everyone, and we'll see you in 2025. Take care.